Good afternoon. I'm Dr. Shamdeo Prasad, the Chief Medical Officer of the Ministry of Public Health, and I am bringing you today's COVID-19 update. Ladies and gentlemen, yesterday I addressed the male population and urged you to be responsible about adhering to the curfew hours and physical distancing in order to contain the spread of the coronavirus disease. The message I wish to reinforce is to remind you that as breadwinners of the family, you put yourself at unnecessary risk and jeopardize the life and livelihood of your families by not complying with the recommended measures. Ladies and gentlemen, we continue to appeal to you to come forward if you have been in contact with a positive case or experiencing any of the symptoms associated with COVID-19. We are pleading with you to access our mobile units positioned at various points in the city, as well as the COVID-19 sites on the East Coast and East Bank of Demerara. Please call the hotline for information on the location of these mobile sites. As I said yesterday, testing is critical if we are to uncover the asymptomatic cases and to provide them with the necessary screening and assist in reducing the numbers of illness and deaths due to the severe form of the disease. Please note that Guyana's fatality rate stands at 10.8%, whereas the WHO global fatality rate is 4%. This simply means that we must detect those in our communities showing no sign or symptoms but require medical intervention. I wish to provide some more insight into the asymptomatic case, which account for most of our confirmed cases in Guyana. From information provided globally, many healthy young persons infected with COVID-19 do not display the usual symptoms. These persons can continue to transmit the virus to other vulnerable persons in our society by not practicing control measures such as hand hygiene, physical distancing, and the use of a face mask. Now for the global report. Globally, according to WHO report dated the 6th of May 2020, there are 3,588,773 confirmed cases with 247,503 deaths. In the region of the Americas, there are 1,507,148 confirmed cases with 81,070 deaths, an increase of 1,408 deaths in the last 24 hours. Ladies and gentlemen, when we refer to the region of the Americas, we are talking about Guyana, the United States of America, and neighboring Brazil, among others. Please note that the USA and Brazil occupy the first and second position, respectively, with the highest numbers of positive cases. I want to draw your attention to Brazil, which has 107,780 cases with 7,321 deaths. For Guyana, this simply means that our bordering regions with Brazil are at additional risk of contracting the coronavirus disease. So all residents, especially of Region 9, are asked to be extremely vigilant and comply with all the control measures. Today, in our country, we are reporting no new cases. An additional 22 tests were done, bringing the total numbers of persons tested to 736, with a total number of confirmed cases remaining at 93. The number of persons recovered thus far has increased to 34, and our COVID-19 deaths remain at 10. 643 persons have tested negative so far. There are 3 persons in our COVID-19 ICU, 6 in our institutional quarantine, and 49 in isolation. To date, the total number of patients seen in the COVID-19 ICU is 26, with 7 deaths being registered within the ICU. The total numbers of patients who were transferred from the ICU is 13, with the total number of patients who recovered and were discharged from the ICU being 3. Of all positive cases, children account for 5.4%, adults 82%, and the elderly 12.6%. Even though 52% of our confirmed cases were males, they accounted for 80% of the COVID-19 deaths in Guyana. I wish to end today's briefing by reminding you of the important role that you must play. COVID-19 is still in our midst. We cannot let our guard down. Remember that COVID-19 is not only a concern of the Ministry of Public Health, but the entire nation. So we ask you to be supportive and cooperate with all those at the front line of this fight so that we can return to normalcy. Additionally, for those who have recovered, let us respect and give them our full support as they reintegrate into our communities and society at large. Stay at home, practice safe hygiene measures, and observe the curfew. Let us stay safe and save lives. I thank you.